A rainy night, empty hospital parking lot. A man in a sedan slows down when he sees a figure collapsed on the wet pavement near the emergency entrance. He pulls over and freezes. A woman in scrubs lies motionless, stethoscope still draped around her neck, rain pooling around her body like a dark halo. He doesn't hesitate. He runs. His shoes splash through puddles as he drops to his knees beside her. He checks for a pulse. Barely there, thread thin beneath his fingertips. Her lips are blue. She's not breathing right. Shallow gasps that sound like wet paper tearing. He tilts her head back, checks her airway, and immediately begins CPR. His hands move with practiced precision, fingers laced, compression steady and deep. 1, 2, 3, 4. He counts silently, his body remembering what his mind has tried to forget. 30 compressions, 2 rescue breaths. Her chest rises and falls under his command. He doesn't stop, can't stop. Rain soaks through his jacket, plasters his hair to his forehead, but his hands never falter. Minutes feel like hours. Then sirens. Red and blue lights wash across the parking lot. Paramedics burst from the ambulance, equipment in hand, ready to take over. But when they see him, they stop. Just for a second. One of them, a veteran EMT with 20 years on the job, stares at the positioning of the man's hands, the angle of the woman's head, the textbook perfection of every movement. He whispers to his partner, loud enough for the kneeling man to hear. "Who the hell did this? This is surgical-level technique." The man doesn't respond. He just keeps going until the paramedics gently pull him back, sliding a bag valve mask over the woman's face, checking vitals, loading her onto a stretcher. Her eyes flutter open for just a moment, confused, scared. The man leans close and says quietly, "You collapsed. Your heart stopped. You're okay now." She tries to speak, but can't. The paramedics rush her into the ambulance. One of them turns back. "Sir, you saved her life. We need you to come with us. The hospital will want to talk to you." The man hesitates. Every instinct screams at him to leave, to get back in his car and drive away before anyone asks questions he doesn't want to answer. But he nods. He follows. Inside the ER, controlled chaos erupts. Nurses swarm the woman, hooking her to monitors, starting IVs, calling for a doctor. The man tries to slip toward the exit, but a physician in green scrubs blocks his path. "Sir, you saved her life. What's your medical training?" The man's jaw tightens. He looks at the floor. "I used to be a doctor." The physician's eyes widen. He glances back at the woman now stabilized on a gurney, then at the man standing before him. Whoever did that CPR knew exactly what they were doing. Textbook hand placement. Perfect compression depth. You didn't just save her, you gave her back. The man says nothing. He just turns and walks out into the rain. But the questions don't end there. Inside the ICU, the woman, a nurse named Sarah Bennett, lies in a bed she's walked past 1,000 times while caring for others. The cruelty of the irony isn't lost on anyone. Her supervisor reviews her schedule with trembling hands. 16-hour shift, third double in 5 days. The numbers tell a story no one wants to hear. Hospital Administrator Dr. Catherine Walsh is called. When she arrives and hears what happened, her face goes pale. "Another one," she whispers. "That's the 3rd staff member this year." She asks the ER doctor, "Who did the initial resuscitation?" He shows her the security footage. A man in civilian clothes, kneeling in the rain, performing flawless CPR. "We need to find him," Walsh says. The man's name is Michael Brennan. 48 hours after saving Sarah Bennett's life, he wakes at 5 in the morning like he does every day. The apartment is small, modest, the kind of place where you can hear your neighbor's television through the wall. He moves quietly through the kitchen, cracking eggs into a pan, toasting bread, pouring orange juice. His son, 7-year-old Ethan, pads out in dinosaur pajamas, rubbing sleep from his eyes. "Morning, champ," Michael says, ruffling the boy's hair. They eat together in comfortable silence, the kind that comes from years of just the two of them. Ethan watches his father's hands as he cuts his toast into perfect squares. "Dad, why are your hands so steady, like a doctor's?" Michael pauses, just for a heartbeat. Then he smiles. "Just careful, buddy." But the boy is perceptive. He's asked before. He'll ask again. Michael's job is medical supply sales. The irony would be funny if it weren't so painful. He drives to hospitals, walks through their loading docks, delivers surgical kits and IV supplies and monitoring equipment. But he never goes inside the wards, never looks through the windows into the ORs where he used to stand for hours, hands deep in someone's chest cavity, fighting death with every tool he had. He drops off the supplies, collects the signatures, and leaves. Every day, his route takes him past County Memorial Hospital, a sprawling complex of glass and steel. Every day, he keeps his eyes on the road. Never looks left. Never lets himself remember what it felt like to walk through those doors, in scrubs, a stethoscope around his neck, a pager clipped to his belt. On the chain under his shirt, hidden from the world, he wears a ring. It's delicate, gold, engraved on the inside with a name. Rebecca, his late wife's medical school ring. He's never taken it off. At home, in the back of his closet, buried under old jackets and boxes of Ethan's baby clothes, are surgical textbooks. He hasn't opened them in 3 years, but he can't throw them away. Michael Brennan wasn't always a salesman. He was Lieutenant Colonel Michael Brennan, Army trauma surgeon, chief of surgery at Walter Reed Medical Center. He met Rebecca during their residency, 2 exhausted interns stealing moments between 36-hour shifts. She was brilliant, fierce, a pediatric surgeon who could make a scared child smile even as she prepped them for the OR. They deployed together, saved lives in places where death was a constant companion, where the sound of helicopter rotors meant another wave of shattered bodies. Ethan was born between deployments, a tiny miracle they held on to during the long months apart. They were a team, in the operating room, in life. And then, 3 years ago, Rebecca died. Not in a war zone, not in some distant country under enemy fire. She died during a routine surgery at a civilian hospital, a gallbladder removal that should have been textbook. But the surgical team was understaffed. The anesthesiologist was on hour 22 of his shift. A complication arose, a bleed that should have been caught immediately, but exhausted hands missed it. By the time they realized, it was too late. Michael was on a sales call when he got the phone call. He wasn't there, couldn't save her. The autopsy confirmed what he already knew. Preventable. The word haunted him. A preventable complication, missed by an exhausted resident. Rebecca, who had saved countless children, died because the system she trusted failed her. Michael spiraled. Quit medicine, left the army, took a civilian sales job that kept him far from operating rooms and the ghosts that lived there. Ethan, barely 4 years old, asked him once, tears streaming down his face, "Why couldn't the doctors help Mommy?" Michael had no answer. Still doesn't. The call comes 2 days after he saved Sarah Bennett. It's late, almost 11 at night, rain hammering against the windows. Michael is finishing paperwork for a sales route when his phone buzzes. He doesn't recognize the number but answers anyway. "Mr. Brennan, this is Dr. Catherine Walsh, administrator at County Memorial Hospital. I apologize for the late hour, but I need to speak with you. It's about the nurse you saved." Michael's stomach tightens. "Is she okay?" She's stable, thanks to you. But I need to ask you some questions. Could you come to my office tomorrow morning? He wants to say no, wants to hang up and pretend this never happened. But something in her voice, a desperation he recognizes, makes him pause. What time? 9 o'clock. I'll be waiting. The next morning, Michael leaves Ethan with a neighbor and drives to County Memorial. He hasn't been inside a hospital as anything other than a delivery driver in 3 years. Walking through the main entrance feels like stepping into a nightmare. The smell hits him first. Antiseptic and floor cleaner and something underneath it all, something he can't name but remembers. He takes the elevator to the administrative floor, hands clenched at his sides. Dr. Walsh's office is all glass and steel, charts on the walls, framed diplomas. She's younger than he expected, mid-40s, with sharp eyes and the kind of exhaustion that comes from carrying impossible weight. Mr. Brennan, thank you for coming. She gestures to a chair. He sits, doesn't relax. I want to thank you for saving Nurse Bennett's life. May I ask about your medical background? Michael's voice is flat. It's in the past. Walsh doesn't flinch. She slides a tablet across the desk, a personnel file open on the screen. His file. Michael Brennan, MD, Army Trauma Surgeon, Chief of Surgery, Walter Reed, Silver Star recipient, multiple commendations for battlefield medicine. You left the Army 3 years ago. She pauses. Your wife, Rebecca Brennan, MD, pediatric surgeon, died during surgery. Medical error. Michael stands. This conversation is over. Please, wait, Walsh says, and there's something raw in her voice that stops him. I'm not trying to hurt you. I'm trying to understand what's happening in my hospital. Sarah Bennett is the 3rd staff member this year to have a medical emergency from overwork. I need to know why a decorated trauma surgeon is delivering medical supplies instead of saving lives. Michael turns, his voice cold. You want to know why? Because I watched my wife die from a preventable error caused by an exhausted, overworked surgical team. Because I couldn't save her. Because I swore I'd never step foot in another OR after I saw what this broken system does to people. Walsh nods slowly. Then, help me fix it. He stares at her. What? I need a patient safety consultant. Someone who understands both medicine and what's at stake. Someone who won't accept corporate excuses. The system that killed your wife is killing my staff. I can't stop it alone. Michael shakes his head. I don't practice medicine anymore. I have a son who needs me stable, not dragged back into the profession that destroyed our family. Walsh stands, pulls a file from her desk. Sarah Bennett's chart. She has a daughter, 10 years old, loves ballet. Sarah collapsed in a parking lot after working 16 hours straight. Her daughter almost lost her mother because we're understaffed and the corporate board won't hire enough nurses. Read this and tell me you can walk away. She hands him the file. Michael takes it, leaves without another word. That night, after Ethan is asleep, Michael opens Sarah's chart. The pattern is there, undeniable. Mandatory overtime, denied vacation requests, punitive scheduling, 60-hour weeks treated as normal. He sees Rebecca in every line, sees the system that chews up healers and spits them out. He closes the file and stares at the ring around his neck. 3 days later, Sarah Bennett, still recovering, shows up at Michael's apartment. She found his address through hospital records, a breach of protocol she doesn't apologize for. Dr. Brennan, they told me you saved my life. Michael opens the door wider, doesn't correct her use of his title. How are you feeling? Like I got hit by a truck, she says with a weak smile. But alive. Can I come in? They sit in his small living room, Ethan at a friend's house. Sarah is pale, moves carefully, but her eyes are determined. Dr. Walsh said she offered you a consulting position. I'm not a doctor anymore, Michael says. Then what are you? Sarah asks. Because the man who saved me knew exactly what he was doing. That wasn't luck. That was years of training. Michael looks away. I can't go back to hospitals. Sarah's voice cracks. I have a 10-year-old daughter. I collapsed in a parking lot because I worked 16 hours straight. My daughter almost lost her mother because the system is broken. If you won't help for me, help for the next person who collapses, because there will be a next person. The words hang in the air. Michael wants to argue, to say it's not his responsibility, that he's done enough, but he can't. After Sarah leaves, Ethan emerges from his room. Michael didn't know he was home. Dad, were you a doctor like Mom? Ethan's voice is small. Michael's throat tightens. Yes. Then why did you stop helping people? The question is innocent, devastating. Michael has no answer. That night, he doesn't sleep. Rebecca's voice whispers in his memory. We became doctors to save lives, Michael. Don't let my death mean yours stops too. The next morning, Michael calls Dr. Walsh. I'll consult, but I don't treat patients. I assess systems, review protocols, make recommendations. That's it. Deal, Walsh says, and he can hear the relief in her voice. For the next 2 weeks, Michael embeds himself in County Memorial Hospital. He interviews staff, reviews schedules, observes workflow. What he finds is worse than he imagined. Nurses working 60 to 70-hour weeks, mandatory overtime with no advance notice, patient-to-nurse ratios that violate every safety guideline, physicians burning out at alarming rates, mental health resources non-existent, staff afraid to report unsafe conditions for fear of retaliation. Sarah, back at work against medical advice, shows him the reality. A 12-bed ICU staffed by 2 nurses during night shifts. Residents making critical decisions on hour 30 of their shifts. He watches a young doctor, barely out of medical school, nearly administer the wrong medication because his hands are shaking from exhaustion. Michael has flashbacks, sees Rebecca on that operating table. He presents his findings to Dr. Walsh and the hospital board. The room is full of men in suits, corporate appointees who care more about profit margins than patient safety. Michael lays it out, page after damning page. The board listens in silence. Then the CFO speaks. Mr. Brennan, these metrics are industry standard. Every hospital operates this way. Michael's voice is quiet, dangerous. Then the industry is killing people. The board dismisses his concerns, offers minor cosmetic adjustments, refuses to increase staffing or limit mandatory overtime. Michael stands, fury barely contained. You're going to keep pushing these people until they break, and when they do, their blood is on your hands. He walks out. Dr. Walsh follows him to the elevator. Don't give up. Give me time to fight this. I'm done, Michael says. I tried. They don't care. The elevator doors close. 2 weeks later, Friday night, Michael is at home with Ethan when the news breaks. Multi-vehicle pileup on the highway. 23 casualties, all heading to County Memorial. Michael's stomach drops. He remembers he left his medical tablet at the hospital during his consultancy. He needs it for work Monday. Ethan, I'll be right back, he says, grabbing his keys. Stay with Mrs. Patterson next door. He drives to County Memorial, telling himself it's just to grab his tablet. Nothing more. But when he arrives, the parking lot is chaos. Ambulances everywhere, sirens wailing, staff running. He parks and walks toward the entrance, just to see, just to check. Inside the ER, it's a war zone. Patients on gurneys line the hallways. Nurses and doctors move in controlled panic, triaging, stabilizing, deciding who gets care first. Michael stands frozen at the entrance. Then he sees Sarah. She's helping triage, moving too fast for someone who nearly died 2 weeks ago, when she clutches her chest. Her face goes white. She collapses. "Sarah!" someone screams. Staff rush to her, but they're overwhelmed. A doctor is in surgery. Another is intubating a patient. If they stop treating the other casualties to help Sarah, people die. Michael watches from the doorway. Watches Sarah on the ground, not breathing. Watches the staff paralyzed by impossible choices. He hears Ethan's voice in his head. "Why did you stop helping people?" He hears Rebecca. "Don't let my death mean yours stops too." Michael walks in. "Someone get me a crash cart, now." Heads turn. A nurse stares. "Who are you?" "Trauma surgeon," Michael says, dropping to his knees beside Sarah. "Where do you need me?" The crash cart arrives. Michael doesn't hesitate. He shocks Sarah's heart, administers drugs, performs perfect ACLS protocol. Her heart restarts. She gasps, eyes flying open. "You're okay," Michael tells her. "I've got you." The ER attending, a young doctor drowning in patients, stares at him. "Where did you come from?" "Doesn't matter. Where do you need me?" Michael asks. The doctor doesn't question it, can't afford to. "Trauma Bay 2. Chest trauma, possible pneumothorax." Michael moves. For the next 14 hours, he doesn't stop. He performs 3 emergency surgeries, coordinates the resident team, saves patient after patient with precision and compassion he thought he'd lost. The muscle memory returns, his hands remembering what his heart tried to forget. Dawn breaks. The last patient is stabilized. The ER finally quiets. Michael, exhausted, sits in an empty operating room, still in borrowed scrubs, blood on his hands. Dr. Walsh finds him there. "Thank you. You saved Sarah. You saved them all." Michael looks up, and for the first time in 3 years, tears come. "I forgot what this felt like. Helping people. Being a doctor. I've been so angry for so long." Walsh sits beside him. "You're still a doctor, Michael. You always were." The mass casualty event makes national news. Understaffed hospital saved by retired Army surgeon. Corporate ownership faces a PR disaster and regulatory scrutiny. Within a week, the hospital board is forced to implement Michael's reforms: mandatory nurse-to-patient ratios, overtime limits and mandatory rest periods, mental health services for all staff, a hiring surge to meet safe staffing levels, whistleblower protections for safety concerns. Dr. Walsh offers Michael the position of chief medical officer. He declines. "That's not my path," he says, "but I know what is." 3 months later, Michael opens a clinic. Not a traditional practice, something different. The sign outside reads, "Brennan Wellness Center, Healthcare for Healthcare Workers." It's a small space, but it's his. He treats nurses, doctors, paramedics, EMTs, the healers who never get to be patients, who sacrifice everything and receive nothing in return. Sarah, fully recovered and working safe hours, is his first patient. Then she becomes his colleague, running the nurse wellness program. Ethan, now 8, visits the clinic after school. He watches his father take a patient's blood pressure, explain treatment options, listen with the kind of attention that makes people feel seen. One afternoon, Michael teaches Ethan to take a pulse. The boy's small fingers find the rhythm on his own wrist. "Dad, is this what you and Mom did?" Ethan asks. Michael, wearing Rebecca's ring openly now on his own hand, nods. "Yes, we helped people, and now we help the people who help people." Ethan smiles. "I think Mom would be happy you're a doctor again." Michael pulls his son close. "I think so too, buddy." On the clinic wall, 2 diplomas hang side by side, Michael's and Rebecca's. Between them, an inscription reads, in memory of Dr. Rebecca Brennan and in service to all healthcare workers who give everything to save others. That evening, a new patient arrives, a burned-out ER doctor, barely 40 but looking 60, hands shaking, eyes hollow. Michael recognizes the look. He's seen it in the mirror. He guides the doctor to an exam room and says gently, "You've spent your career saving lives. Today, let someone save yours." The doctor breaks down. Michael sits with him, listens, doesn't rush. This is his calling now. Not the operating room, not the battlefield, but something equally important. Healing the healers, making sure no one else collapses in a parking lot, making sure Rebecca's death meant something. As the sun sets, Michael locks up the clinic and drives home to Ethan. The ring on his finger catches the light. He's not running anymore, not hiding. He's exactly where he's supposed to be. A doctor, a father, a man who learned that sometimes the greatest way to honor the dead is to fight like hell for the living.